Okay, so our sixth specialty talk for today will be given by Dr. Rakan Alsaad. Dr. Rakan is a PGY2 Ophthalmology resident at King Saud University. And Doctor, thank you so much for agreeing to give us this talk. You can start whenever you're free.
Assalamu alaikum, everyone. Can you hear me clearly?
Yes, Doctor.
Okay. First of all, thank you for the warm introduction. So as was just mentioned, my name is Rakan Alsaad. I'm a second-year ophthalmology resident at KSU, and I'm also an Alfaisal graduate from the 7th batch. So just give me a second. I'm gonna just share my screen. Is my screen being shared?
Yes.
Okay, just 1 second. Okay, all clear?
Yes, Doctor.
Okay, great. So just like I mentioned, my name is Rakan Alsaad. I'm a second-year ophthalmology resident at KSU. And today I'll be talking about ophthalmology residency and what it's about, what to expect, and how to aim for a career in ophthalmology. So today I'm going to be this is an overview about today's talk. It's mainly I'm going to talk briefly about my story with ophthalmology, the ophthalmology residency along with its subspecialties, the available cities for residency, as well as the average, what are the minimum scores for last year, and the number of seats in each center. And then the second part will be about the rotations in ophthalmology residency, the basic science course, which I'll be delving into later on, as well as how on-calls work, educational activities, and just how a week in the life of an ophthalmologist usually is في السعودية. So for my story, just briefly, I'm not going to go into it into detail, but for me personally, my main interest initially was internal medicine and neurology. Surgical subspecialties were not really something I was considering. And ophthalmology in specific was not something I actually wanted to pursue. However, my batch, the 7th batch, we were the last batch in Alfaisal to have our ophthalmology rotation in KFSH. The KFSH ophthalmology rotation was not very well organized. And that's, I think, one reason why people actually did not like ophthalmology. And I think the batches after us, everything was through KKish. And ever since that happened, I noticed a lot of people from Alfaisal are actually very interested in ophthalmology. So my interest in ophthalmology started in my last year of med school, which is around 5th year. And everyone was telling me it's too late. You don't have enough time to prepare your documents, do research, do whatsoever. But I kept on going because I really enjoyed ophthalmology. And alhamdulillah, looking back right now, I don't have a single regret in choosing ophthalmology. But enough about my story, just now about the residency itself. Oops. So ophthalmology, it's a 4-year residency program. And it's kind of special in that it's the only surgical subspecialty, or it's the only surgical specialty that's not 5 years long. And for example, general surgery, orthopedic surgery, etc., all of them are 5 years long, but ophthalmology is the only one that's 4 years. And unfortunately, it's one of the most competitive specialties. I think it's the most competitive specialty after plastic surgery. And one of the reasons why I like ophthalmology in general is that you can achieve a very decent work-life balance. And your work will not be overwhelming. You can still have a very good life as well as social life. It is greatly rewarding in that patients are almost always satisfied whether it's through medical treatment or surgical treatment. Another reason why I also love ophthalmology is because there's an equal contribution between medical and surgical management. Now for the specifics of the ophthalmology residency, first of all, it's an extremely meticulous specialty. And most of what you're going to learn throughout your residency is going to be new information. There are any things you have not really come across in med school. So that can be a good sign or a bad sign, depending on how you see it. And most of the surgeries in ophthalmology are microsurgery, We use microscopes, we use micro instruments, and you need to have a very good eye-hand coordination. But so this takes time and it will develop throughout your residency. And another nice aspect about the field is that ophthalmologists are a very small community, and almost all ophthalmologists in the country know each other. I will explain this further on, but just keep this in mind in that we're a very small community and we know each other very well. Now for the subspecialties in ophthalmology, there are 9 subspecialties. We have anterior segment, glaucoma, neuro-ophthalmology, as well as ocular oncology. However, ocular oncology is, it overlaps with a lot of other fields. We also have oculoplastics and orbital surgery, ophthalmic pathology, pediatrics and strabismus, as well as uveitis and vitreoretinal surgery. I'm going to be going briefly over each subspecialty, just to give you a glimpse of the kind of cases that we come across in each subspecialty, whether that's in clinic or in the OR. Now for anterior segment, we mainly deal with these kind of, let's say, problems. Patients who are willing to, patients who want to do refractive surgery, or patients who have cataract surgery. Cataract surgery is, it's the bread and butter surgery of any ophthalmologist. For example, in GS, you have appendicitis, or let's say cholecystectomies and appendectomies. In ophthalmology, it's cataract surgery. And lastly, for example, we can do corneal transplants. Now that's for anterior segment. For glaucoma, you're mostly going to be dealing with adult patients who have glaucoma, congenital glaucoma, and the main forms of treatment in these patients are medical and surgical management. There's a lot of variety in all the subspecialties, which is a nice thing that I enjoy. Now for neuro-ophthalmology, it is a big overlap between neurology and ophthalmology, specifically about the optic pathways, the neural pathways. So this is one of the specialties that I enjoyed a lot, both in med school and in residency right now. So we're going to be dealing with cranial nerve palsies, as well as nystagmus, and also patients who have idiopathic intracranial hypertension, as well as optic neuritis. But the focus is extremely neurological. There aren't many interventions, surgical interventions that you would do as a neuro-ophthalmologist, but it's a very interesting specialty if you really enjoy neurology as well. Now for oculoplastics orbital surgery. Oculoplastics mainly deals with issues of the globe itself, the eye and the eyelid. So for example, here we have a patient with ptosis. We usually do ptosis correction surgery. And in patients who have thyroid orbitopathy, for example, in Graves' disease, who have severe orbitopathy, you can see that we have thyroid decompression surgery. You can see that the proptosis is almost corrected after the surgery. And some of the severe or comorbid or morbid issues, for example, would be orbital tumors, such as in this child who has a rhabdomyosarcoma in the right eye. So after treatment, patients do fine and we follow them regularly. And the last or the final part of the specialty is the plastics part. It's basically plastic surgery of the eyelid and the area around it. So we usually do eyelid cosmetic and reconstructive surgery. Now for ophthalmic pathology, this can be, you can go into this through ophthalmology or pathology. I just wanted to bring it up just for the sake of completing everything. So in ophthalmic pathology, it's like any other kind of pathology. You take specimens, you dissect them, you see them under the microscope. And in this case, we have a picture of an eye with retinoblastoma. You can see that the eye is completely filled with a tumor in this case. And here's the same thing under the microscope. Now for pediatrics and strabismus, you're mainly going to be dealing with pediatric patients. However, you can still also deal with adult patients who have strabismus. So the main things you're going to be doing in residency, or if you pursue a career in pediatric ophthalmology, you'll be doing refractive error in pediatric patients, dealing with patients who have strabismus, and as well as congenital cataracts and other issues. But I'm only bringing the most common things that we see on a regular basis. Now for retina and uveitis, it's a very, very, very vast field. Yani, I only wanted to bring the very common and yani, let's say well understood issues. For example, cases of people who have retinal detachment, or in patients who have uveitis. You can see that the eye is extremely red here. You can see some collection here in the eye. We call this a hypopion. Usually it happens in infectious processes. And you can also see ophthalmic manifestations of diabetes. For example, in this case, we have vitreous hemorrhage, which is bleeding inside the eye. So you can see a lot of different things in retina and uveitis. Now for the second part, or the continuation of the first part of the talk, is that what are the cities that have residencies in ophthalmology? First of all, we have Riyadh, and this should be omitted because we have Riyadh, we have Eastern Province, we also have Jeddah, Mecca, Southern Province, as well as Al Medina and Al Taif. So all these cities have ophthalmic residencies. Now, this is based on last year's score, as in the people who are now R1s. This was their minimum score for nomination. I got this from the Hayat al-Takhasusat sheet. So basically, Riyadh had the high. I'm only going to go over the first three. Riyadh had the highest minimum score, which was around 84.16. Jeddah had 83.96. And Eastern Province had 83.72. So you can see that it's one of the most competitive specialties. And comparing this to my own year, when I applied, it went up by 2 points. So the competition, unfortunately, keeps getting higher and higher. But if you put your head to it, inshallah, you'll be able to get it. Now, you can scan this if you want. This is basically, it will show you the website that actually has the scores and the accumulative, averages and minimum scores. Now, these are the number of seats available per city, but keep in mind, this was based on the year I went into residency. So I got accepted into residency around 2019, and I started in 2020. But they count this as the 2020 match. So Riyadh has around 25 seats. Eastern Province has around 13 seats. The Western Province used to be a joint program, but I think as of last year, they separated. Now it's Jeddah is separate, Mecca is separate. So I'm assuming it's going to be like 5-5 or maybe more distribution in Jeddah. Southern Province takes 3 residents, Al Medina takes 2 residents, and Al Taif takes around 3 residents. Now for the centers, I'm only going to be talking about the centers in Riyadh because these are the ones that I actually know about. So the centers for Riyadh are KKH, which is King Khalid Eye Specialist Hospital, KAUH, which is where I'm working at right now. This is King Abdulaziz University Hospital. This is the eye and ear hospital that's for KSU. KSU has 2 main hospitals. It has KKUH, which is the main big hospital, King Khalid University Hospital, and it has KAUH, which is the eye and ear hospital. Now for the third hospital, we have PSMMC, which is Al Askari. Al Askari also is a really good center. National Guard, which is Al Haras, also is a really good center. And lastly, we have KFSH and Research Center. So the distribution, I forgot to add this slide, but basically the distribution among all of these centers, I'm going to be talking about it in the next slide. But for the rest of the provinces, they're usually joint programs, so I don't really know much about them. But for the Riyadh centers, for example, I put all the centers here in this picture or in this slide. KKH takes around 9 residents per year. My hospital takes around 6 residents per year. National Guard, which is Al Haras, takes around, if I'm not mistaken, 4. And KFSH only takes 1 resident. KFSH used to be part of a joint program in Riyadh, but that program was disassembled and only KFSH is ongoing. So it takes 1 resident. And PSMMC takes around 4 residents as well. Now, I'm not going to go over this a lot, but this is just briefly how the rotations are divided across your 4 years of residency. The only thing that I want to talk about are going to be this one, the basic science course. So basically the basic science course is a 2 months course that I'm going to be talking about in the next slide. And here we have one rotation that says Anterior Segment India. Basically, before COVID was a thing, we ophthalmology residents across the country had the chance to go to India for 1 month to do cataract surgeries. So that was a really, really good thing with training, but with COVID, that's been halted for the time being. And lastly, in your final year, I think you have 1 or 2 months of electives. I need to double check if it's 1 or 2 though. So this is the manual for Hayat al-Takhasusat for ophthalmology. You can scan this if you want. It shows all the available rotations, all the available or all the possible cases you would deal with as an ophthalmologist in all the subspecialties. And it's a nice overview about the specialty as a whole. Now, the basic science course. So the basic science course, it's basically a course that you take as an ophthalmology resident, specifically an R1 in your first 2 months of residency. So this course is mostly going to be novel information. And because of the poor exposure in med school with ophthalmology, everything you take in this course will be almost completely new to you. It's not really a crash course, but it's basically everything in ophthalmology condensed in 2 months. So it's very heavy. It's very exhausting. It will exhaust you, but it will at least give you a solid foundation. So the basic science course will be covering all ophthalmic subspecialties and subspecialties, but it will focus on the basic medical sciences, the basics immunology of the eye, the basic histology of the eye, and etc. And it will slowly build you up until you reach the clinical aspects. Now, the course is going to be 2 months, so it's going to be in October and in November. They will be purely lectures. You will not have any kind of work whatsoever, except you might have attachment on calls. Basically, attachment on calls are only for Riyadh residents, because this course, it takes place in Riyadh, and all of the ophthalmology residents across the country have to come to Riyadh to attend the course. But now with COVID, you have the option to attend it online or if you want physically. But the residents in Riyadh, they have attachment on calls. So after the lectures, they would go to their own respective hospitals and have attachment on calls, in that they'll be with their own teams. They'll be shadowing their on-calls, but their on-calls are not full days. They're only a few hours long. After this basic science course, there's usually an exam, and this exam makes up 20% of the residency part 1 exam. Now for on-calls. The on-calls, Salaha, it depends on the center you're going to be accepted in, inshallah. But the main thing you're gonna be doing is covering ophthalmic emergencies. And the ophthalmology ER is basically a walk-in clinic, but for all subspecialties. You're going to be seeing glaucoma cases, retina cases, and cornea cases, pediatric cases. It's very specific. So you can deal with minor complaints such as eye dryness or conjunctivitis, or to the even more severe cases such as retinal detachment and ruptured globes. And ophthalmology on calls in general are relatively less taxed. They're less taxing than other specialties. They're much more relaxed, and they're not as, let's say, stress-inducing. But as I mentioned earlier, the responsibilities will differ depending on the center you work for. Like, for example, in my hospital, because I'm in KSU, I cover King Abdulaziz University Hospital, which is the eye-specific hospital, and I also cover KKUH. KKUH is a trauma center. So we can see if there's any patient who was in a, for example, road traffic accident, they have a polytrauma, for example, facial fractures, bone fractures, rib fractures. If there's an issue with the eye, we have to come and assess the patient as well. Now, for educational activities in ophthalmology, this also depends on the center, but however, most of these activities are very common in all centers. So usually there are weekly resident teaching rounds, basically where the senior residents will always have a lecture or a topic teaching it to their junior residents. And weekly consultant teaching rounds is the same thing, except that the consultant will bring a topic, or they will have cases and discuss them with the residents on a weekly basis. And we have monthly journal club meetings. Every month we'll have a different theme, a different subspecialty. And lastly, we have the monthly subspecialty combined teaching round. This is basically, for example, in each subspecialty or department, they have a number of difficult cases. So all the consultants in that respective field, they will gather around, discuss the cases with other consultants, with the residents who are rotating with them in that month, with the fellows. So it's a nice opportunity to see different perspectives, different levels of management and teaching. And lastly, there's something that that's one of the nice features or things I like about residency in Riyadh. We have the weekly grand rounds. The weekly grand rounds are basically a 4-hour educational activity, or it's an academic half day, but we call it a grand round. So basically all Riyadh residents at Tuesday in the afternoon, from 1 p.m. until 5 p.m., we have lectures. These are divided, for example, and every week there's a theme. 1 hour is going to be a subspecialty lecture. 1 hour is going to be an imaging conference or imaging lecture. 1 hour is going to be a quiz with a discussion after the quiz, and as well as case presentations. So because of this grand round, all Riyadh residents know each other very, very well. And along with all of these activities, we have the regular clinic and OR learning, which happens on a daily basis. Now, okay, Khalas, you're in ophthalmology. How is your life going to be on a daily basis? So usually per week, you're going to be part of 1 or 2 consultants teams per month. You will have 1 day for clinic and 1 day for OR. And one of the nice features, is that as an ophthalmologist, we don't really have inpatients. So we don't do rounds. We would do rounds if we have, but most of our inpatients are post-op patients that leave after 1 to 2 days, or uveitis patients who are receiving systemic treatment. So as I mentioned, 1 day OR, 1 day clinic, and then the weekly grand round on Tuesday for the Riyadh residents. Now, this is just a breakdown for day by day. For example, Sunday, you would have OR, and Monday you would have clinic. This can be either a morning session, afternoon session, or even both. Tuesday will be only a morning session because of the afternoon grand round session. And Wednesday is the same thing. You have clinic, but then Thursday OR, and Friday and Saturday, just enjoy your time unless you're on call. And one golden rule that I live by is that on Thursdays, I don't usually try to do anything productive unless you have an upcoming exam. Or you're on call, obviously. But other than that, things are very smooth, they're very nice and not very hectic. This is just something that I came across, is that it's just showing the level of happiness. And as well, they asked a bunch of specialties if they regret choosing their specialty, or if they were given the chance to choose another specialty, would they choose the same one again? And ophthalmology was in the top 3. 95% don't regret their decision. So I think it's a very overall nice specialty. And thank you for listening. If you have any questions, feel free to ask them in the chat, or open your mics and ask me. And thank you.
Thank you for the wonderful presentation, Doctor. It was indeed very beneficial, and we truly value your experience and guidance. And if anyone has any questions, please feel free to put them in the chat, or you can unmute yourself and ask a question now.
There's one here. Yeah, في one question about the publication. هل عادي إذا بدأت research للأفضل بالسنة الأخيرة من الطب لسه ما صار publication? Yes, they don't mind that. I worked on a paper. It got published 1 week before the match. I think one week حتى before the interview. You can still include that in your CV. So the only obstacle in the beginning is the HEA match. You just need to meet the certain requirements for the initial match, and later on يعني in the interview things will be smooth يعني even if it's not published, as long as يعني you know what the paper is about, what exactly you did, what you worked on, and that's what they care about. Because يعني realistically speaking, it's very difficult to work in an ophthalmology research as a student, because I can see this as a resident, because it's a very advanced field compared to other specialties. Yani most of what's in the residency is advanced even for a resident. Yani even as a student, it's hard to get something published. So having one thing published, or even one that's almost going to be published, is okay. طيب ايش الاشياء اللي تقوي السي في؟ I think الاشياء اللي تقوي السي في اللي هي just the يعني things مثل ما يسد الحملات ومؤتمرات, attending conferences. الحملات for ophthalmology are not very often, or they're not a lot, بس يعني في some about يعني I think blindness awareness, or something about glaucoma, but they don't come around a lot. But as long as you have any things in your CV, even if they're not ophthalmology related, they just show that you're actually active, you're willing to do these حملات, attend conferences, it will help. But يعني for ophthalmology conferences, there are يعني a bunch of conferences. I'll just put my email in case anyone wants to ask me these questions يعني if you go over time. طيب case report, case reports are fine. يعني أنا my suggestion as a student, if or even يعني you're an intern or you're soon to be an intern, case reports are very fine, especially as a student. They will help a lot. Research طبعا بيكون أفضل, لكن case report is something you can start with ophthalmology. It's a very good start. Any more questions? العفو. Okay, anyway, so if there might be any more questions, you guys can still take my email, ask me anything, whenever you want. I'm more than happy to help. If that's it, خلاص, thank you for listening. Enjoy the rest of the talks.
Thank you very much, Doctor.
You're most welcome.